Hey, everybody, good morning. I need a round of applause to everybody in Chicago that's here, right? That's fabulous. Thank you. So for those that don't know me, my name is Stuart Schlossman. I'm president and founder of MS Views and News. Though this is not an MS Views and News program. This is a Yoga Moves MS program. And that's Mindy Eisenberg over there on the right, my right, your left. And she is the one that is responsible for wanting to do this event in this area for today. I want to thank our sponsors and our exhibitors. So giving you the name of our sponsors, we have TG Therapeutics, Biogen, Bristol Myers Squibb, EMD Serono, Horizon Pharmaceuticals, Novartis, Alexion, Genentech, Amneal, who's a new company that most of you have not heard about yet, and Banner Life Sciences. So let's give them a round of applause for supporting this event. Fabulous. With that, now let me introduce Dr. Motl. All right, briefly, Dr. Motl is President, Department of Kinesiology and Nutrition, Director, Integrative Physiology, Laboratory Director, Exercise Neuroscience Research Laboratory, College of Applied Health Sciences, University of Illinois. When do you sleep? Okay. Professor Motl has systematically developed a research agenda that focuses on physical activity and its measurement, predictors, consequences, and interventions in persons with neurologic diseases, particularly multiple sclerosis. Professor Motl has generated a body of research on the validity of common physical activity measures in persons with MS. This has resulted in the foundational research on quantifying differences in physical activity, particularly rates of moderate to vigorous activity in persons with MS. So, I cannot wait to hear what you have to say. So let's bring up Dr. Motl, and he will speak with you for approximately half hour, 35 minutes. Thank you.
Well, good morning. I guess we're almost at afternoon. Thank you for joining us today. And just one quick clarification, I'm not the president of the Department of Kinesiology. I'm just a lowly professor. So I'm going to talk with you about exercise training and multiple sclerosis. And to Mindy's chagrin, I'm not going to spend a lot of time talking about yoga. I'm going to leave that to everybody else. I will lay down my cards right up front. I don't know a lot about yoga, but I'm always interested in studying the benefits of new modalities for improving life with multiple sclerosis. So I'm going to start with an overview. And there have been really major advances in the last decade in our understanding of multiple sclerosis. We now understand that there are 1 million people in the United States who are living with multiple sclerosis. That's nearly 2.5 times greater than the prevalence estimates that we've been utilizing for over 30 years. So that's been a major advancement in our understanding of multiple sclerosis. The other thing that we're learning is that multiple sclerosis and its prevalence is shifting across the lifespan. We used to think of multiple sclerosis as really a disease that affects individuals in their 20s, 30s, and 40s. But nowadays, we're understanding that MS is most prevalent in individuals who are 55 to 60 years of age. And as our population continues to age, that's only going to increase over time. What we know about MS is that it is an immune-mediated neurodegenerative disease of the central nervous system. It results in demyelination and transections of axons, and ultimately the loss of neurons throughout the brain, brainstem, and spinal cord. Some of the more common consequences of this disease that I'm going to talk about today are cognitive and walking-related problems that have huge impacts in the lives of individuals with MS. We further know that this disease results in fatigue, and fatigue is a very debilitating symptom, depression and pain along those lines. And this ultimately compromises the quality of an individual's life and the loss of independence. When we think about MS, we know that the first line of treatment is disease-modifying therapies. And I'm not going to talk a lot about disease-modifying therapies, but there are an ever-expanding list of these drugs that are the first-line approach for managing this disease. What I'm more interested in is what I would call the second line of management. The second line of management really focuses on the idea of rehabilitation and wellness, and yoga fits right into the notion of rehabilitation and wellness. And this has really become something that's quite important in the world of MS. And we've learned more about this by doing social learning experiments and listening to what people with multiple sclerosis are saying based on their search of the internet and the topics that they're interested in. And one of the things that we've learned is that wellness and lifestyle behaviors are the most commonly searched terms by people with multiple sclerosis throughout the internet, more common than things like disease-modifying drugs. And so this helps us understand that lifestyle behaviors are really prominent and important in the lives of people with multiple sclerosis, and it's something that they're very interested and invested in learning more about. We know in particular that diet is actually the most important topic that people with MS are interested in. But right closely behind that is exercise, and exercise including things like yoga and what I'm going to talk a little bit more about today. From this, I worked with the National MS Society to create a wellness working group. We're a group of scientists who are dedicated to coming up with the latest and greatest scientific evidence for the application of wellness-related behaviors for not just managing the symptoms and the consequences of disease, but ultimately for managing the disease itself. And so this is really a new change and a new era of the study of wellness in MS, the idea that maybe this can be used to manage the disease. So I focus on exercise. I'm someone who's trained in neuroscience and kinesiology. And we focus on exercise because exercise is one of the most powerful and potent stimuli to activate nearly every system in the human body. When someone engages in a bout of exercise, it activates the central nervous system, the peripheral nervous system, the endocrine system, the skeletal muscle system, the cardiovascular system. It does so in a very integrative and systematic manner. And by repeatedly exposing yourself to bouts of exercise, all of these systems in an integrative manner adapt. They grow stronger. They grow better. And we know that this occurs in the general population, and we know that this occurs in people with multiple sclerosis. Regular bouts of exercise activate all of these systems. They learn how to work better, and this results in many of the benefits that we see. Now, one of the things that we've been focusing on is aerobic fitness and aerobic power. It turns out from the literature that I really spend most of my time in that aerobic power is the most important factor from exercise training for explaining all of the different adaptations and benefits that we see with exercise in the general population and in people with multiple sclerosis. So I'm going to spend my time talking about that. That doesn't undermine the value of yoga. Yoga is something that can be very complementary and beneficial beyond what I'm going to talk about today. So I'm going to talk about first aerobic fitness in MS. When we talk about aerobic fitness, we're talking about oxygen delivery and oxygen delivery throughout the body. And when we talk about oxygen delivery, I'm going to make this very simple. We're talking about the cardiovascular system, the ability to push blood through the human body. And we're talking about the muscle tissue itself and its ability to extract oxygen out of the blood to do exercise. And this happens in a very systematic and coordinated fashion. And that's what this little cartoon is over here to help you understand that when people move from rest to very heavy exercise, the body responds in a coordinated way to send blood to the activated tissue, that is the muscle, and away from other tissues so that the muscle can adapt. And every system in the body is involved in regulating how this works. And so aerobic fitness is the factor that underlies all of this process. Now, there are lots of protocols for measuring aerobic fitness, and we've developed many of these over the last 22 years that we've been involved in exercise in people with MS. Sometimes we have people ride a bicycle ergometer, and we have them ride a ramp that keeps getting steeper and steeper and steeper until they can't pedal any longer, and we're measuring their aerobic fitness during that. Sometimes we'll use a treadmill where people will walk at a set speed, and the grade will get steeper and steeper and steeper until they can't walk any further. And other times we'll use a new step, an arm-leg recumbent ergometer. And the nice thing about this is that it allows people to use their arms and their legs during these exercise tests. And why that's so important is that we know that people with MS have leg weakness in particular, or have some loss of function with the legs. And so this allows us to use the arms and the legs. The other thing you'll notice is that this is seated. So it's a much safer modality for doing exercise training. And utilizing this technology, we've been able to understand a lot about cardiopulmonary fitness or aerobic power from these tests. We've learned that people with MS have lower aerobic power than the general population. And the degree of lower aerobic power is quite substantial. And that's not to say that MS is causing the reduction in aerobic power. It's that a lot of the lifestyle changes that individuals with MS make because of managing fatigue or pain or other sort of complications of this disease result in inactivity. They result in becoming less physically active and engaging in less exercise, and that results in detraining. The other thing we know is that as the disease worsens, so this scale on the very bottom here is worsening of the disease, we know that the aerobic power of these individuals declines in a very systematic manner. So as the disease is progressing, deconditioning is accelerating. And this is making the disease worse and worse and worse over time. These are data from a colleague of mine in Europe where he summarized all of the evidence on aerobic power in individuals with multiple sclerosis. And what they ultimately report relative to controls is down here, that regardless of how you measure aerobic power, individuals with MS have lower aerobic power. Now, where this becomes very important is that the decline in aerobic power in people with MS compared to controls is substantial enough that it results in many system changes within the human body. So that leads to what I'm going to talk about next, which is what are some of the outcomes of reduced aerobic fitness in persons with multiple sclerosis. So this is a study, or a series of studies that we did while I was at the University of Illinois Urbana-Champaign, where we are looking at aerobic fitness and its relationship to the structure and integrity of the brain using magnetic resonance imaging. And in this study, we had individuals do a test to measure their maximum aerobic power. And then secondarily, we had them do an MRI so we could look at areas of the brain that are often affected with multiple sclerosis. Areas such as the thalamus, which is a major relay area associated with cognition, or the hippocampus, which is another area of the brain that's associated with learning and memory, or the basal ganglia, which are areas of the brain that are associated with movement and the control of movement in a smooth, coordinated manner. And in each of these plots over here, what we're showing is aerobic fitness on the x-axis and a brain structure and its volume on the y-axis. And as aerobic fitness is higher and higher and higher, the volume or the integrity of these different structures is better. And these data suggest that aerobic fitness is important for maintaining the integrity of the brain in people with multiple sclerosis. And if that's true, it suggests that we can start to improve aerobic fitness and increase the volumes of these different structures within the central nervous system. And I hope that's something that is exciting to you, because oftentimes we talk about trying to slow the loss of tissues within the brain. We're talking about improving or increasing the volume of tissues within the brain through aerobic exercise training. These are data looking at aerobic fitness and cognition. And so many of you, when you go see your neurologist, they'll do a test called the Simple Digit Modalities Test, or they'll do tests of learning and memory. And they're doing this to look at neural performance and whether you're having a decline in cognition over time. And so what we became interested in is how is aerobic fitness related to cognitive processing speed, so how fast you can bring information in, make a decision about it, and provide a correct response, and learning and memory. And what we've shown in a few studies is that individuals with MS who have a higher aerobic fitness also have better cognition. They can process information more rapidly, and they can learn and remember information more readily. So again, we're oftentimes talking about slowing the loss of cognition as people with MS develop worse disease over time. In this context, we're talking about using aerobic fitness as a way to improve, to restore in a clinically meaningful manner cognition in people with multiple sclerosis. We've also provided data to show that aerobic fitness is related to how well people ambulate or walk, and the underlying structure of how people walk based on the spatial and temporal aspects of their movement. And these data, again, are suggesting that aerobic fitness, aerobic power, is related to how well individuals with MS walk and the underlying features of their walking pattern and things that are related to fall characteristics and things along those lines. And so what we're showing here is that if you engage in aerobic fitness, you can improve, or aerobic exercise that improves your aerobic fitness, you can improve your ability to walk. That's both walking speed and walking endurance over prolonged periods of time. So these are important if you think about it, because these are the things that allow you to more fully engage in life and not become tired and exhausted. We've looked at aerobic power and fatigue and depression. And in both of these studies here, what we're reporting is that individuals who have higher aerobic power are less likely to be fatigued and less likely to be depressed. And so when we think about fatigue as an example, having higher aerobic power allows you the capacity to do more things in everyday life before you experience that severe level of lassitude that's so debilitating that it interferes with your ability to continue to engage in everyday life tasks. So we're talking about utilizing exercise to improve aerobic power and improve, i.e. reduce the level of fatigue that someone is experiencing in general and over the course of a day. And the same thing is occurring with depressive symptomology. The last thing I want to talk about is health-related quality of life and independence and participation. So this slide here has to do with health-related quality of life. That is, whether individuals are living with poor physical health status and mental health status from a global perspective in life. And these data are suggesting that individuals who have higher aerobic power have better health-related quality of life in both the physical and the mental domains. But what becomes even more important is individuals who have higher aerobic capacity are able to engage in greater activities of daily living. What does that mean? So this means that individuals who have higher aerobic power report that they're better able to engage in shopping, going to the grocery store and being able to take care of those things that are so important to our independence and quality of life. Able to do housekeeping and laundry-related tasks. So if you have higher aerobic fitness, you're better able to do household tasks like cleaning or able to do your laundry and things along those lines. Maintaining the ability to be responsible for your own medication status and things along those lines. And then the other thing that I think becomes very important when we think about multiple sclerosis, there's oftentimes an end result on reduced capacity to work or loss of employment altogether. And these data are suggesting that individuals who have a higher level of aerobic power are able to maintain their occupational status and work full-time for a longer period of time. And that becomes a very important outcome in people with multiple sclerosis. So what I wanted to do there is make the case that aerobic power is a very important endpoint that we need to target to improve brain structure and function, to improve walking and cognition, to improve fatigue, depression, quality of life, and to maintain a high level of independence. But the next question becomes, how do we do this and can we do this? So I'm going to briefly review randomized controlled trials. These are gold standard trials that look at exercise training for improving aerobic power in people with multiple sclerosis. So we're jumping back decades, and it's really important that we jump back decades. This is the first study that was ever conducted and published on aerobic exercise training in people with multiple sclerosis. And this study was led by Jack Pettijan, who was a renowned neurologist at the University of Utah, and his colleague, Ed Gatmeyer, who's a physical therapist at the University of Utah. And what they did is they undertook a very ambitious study. They wanted to do a 15-week aerobic exercise training intervention to look at the outcomes in people with multiple sclerosis. What was really ambitious at the time is that they were doing this when it was thought that aerobic exercise was unsafe and dangerous for people with multiple sclerosis. They were doing this in a landscape where people thought that aerobic exercise might actually make the disease worse, not better. And on top of this, they were using an aerobic exercise stimulus that was very high intensity and vigorous. And many people begin to think, well, if you do that, you're going to cause many complications with multiple sclerosis, such as thermogenic effects, where people heat up and it causes lots of symptomatic results. And so I bring all these things up because this was a very controversial study at the time. It was a study that was funded by the National Institutes of Health of our government, but it was a study that was funded and conducted with a high degree of monitoring for the safety of individuals with multiple sclerosis based on many concerns. And so they did this randomized control trial, 15 weeks of aerobic exercise, 3 to 4 days a week at high intensity exercise compared to a control condition. They measured aerobic power, but they also measured fatigue and a variety of other outcomes. And they did the exercise on this really simple device here. This is a Schwinn Aerodyne, very, very old bike where you pedal the legs and you move your arms back and forth at the same time, and they move around a fan. These things are still out there today. They're a beautiful piece of exercise equipment, and if you can find one at your local thrift store for $5, pick it up and don't waste your money on a treadmill or something far more expensive, because this is simple and it works and they're great. And what they reported here is that there was a significant and meaningful increase in aerobic fitness with this exercise training stimulus over a 15-week period of time. And it not only improved fitness, but it managed many aspects of the disease. So one of the ways that our neurologists and colleagues in neurologists study the disease is they put you through a neurological examination. They come up with something called the Expanded Disability Status score, and they showed in this study that they could actually reduce EDSS scores. Reduce EDSS scores. Most of the studies that we do in the pharmacological world are trying to slow down the worsening of EDSS scores. We're talking about reversing disability in this very early study in people with multiple sclerosis. Now, at the time that they did this study, they weren't doing MRI, they weren't doing very fancy measurements of cognition and fitness. But suffice it to say, this study really put exercise on the map as something that was not harmful, but actually beneficial and had the potential to reverse many of the consequences of the disease. Now, the question becomes, how much can exercise improve aerobic power in people with multiple sclerosis? So this was a paper by a few colleagues of mine where they gathered all of the randomized controlled trials of aerobic exercise training to look at the magnitude of improvement in aerobic power. And what they found in this study is that there was a half standard deviation improvement in aerobic power across all these studies. And is that big? Is that small? Is that enough? In the medical world, a half standard deviation is generally interpreted as resulting in a clinically meaningful benefit in the lives of an individual living with any chronic condition or disease. In this case, a half standard deviation improvement in people with MS translates into secondary improvements in things like cognition, things like mobility, fatigue, depression, health-related quality of life, and the capacity to maintain independence. So this really is considered to be a meaningful and robust benefit that can translate into improving the lives of people with multiple sclerosis. These are data that come out of Europe where they looked at a threshold. So they're looking at a slightly different approach to understand whether or not the improvement in aerobic fitness with exercise training translates into a meaningful benefit. And so what they did is they show this threshold that represents a clinically meaningful improvement in aerobic power to translate into benefits in an individual's life. And then they plot the improvement seen in the studies of aerobic exercise training with multiple sclerosis. And you can see in the majority of the studies, 7 of the 9 that are included in this slide, the improvement is greater than that threshold value. But the other thing you should notice is that there are 2 studies that actually report no improvement in aerobic power, and 1 study that actually reports detraining. That is, aerobic power became worse in the context of an exercise training program. And so the question becomes, well, why would aerobic power not improve, or why would aerobic power actually decline when someone's engaging in exercise training? And the answer is actually quite simple. The stimulus that they used in these studies was not the right exercise training stimulus. So what they had individuals do was not strong enough to actually yield the benefits. And in one case, it was so minimal that over a course of 6 months, people actually declined in their aerobic power. So what this means is we need to make sure that we get the prescription of aerobic exercise training right so that we can actually make sure that people reap the benefits that they're hoping to get through exercise training. So with that said, let's talk about guidelines. Let's talk about the prescription that people need to do to improve aerobic power and reap the benefits, and then also talk about safety. So I was involved in a very important and meaningful effort that was led by this young lady here, Amy Latimer Chung, who is a kinesiologist in Canada, and a subsequent effort by Roz Kolb, who is a main constituent at the National Multiple Sclerosis Society. And what we wanted to do is gather all the data that was published on exercise training in people with multiple sclerosis and really dive deep into this literature to identify the exact prescription that people with multiple sclerosis need to undertake to reap the benefits of exercise training. And so in the context of this activity, we identified 54 randomized controlled trials of exercise training in MS. I hope you guys realize that's a lot of studies that have been conducted to understand the benefits and value of exercise training in people with multiple sclerosis. And what we did is all of the authors on this paper, we flew to Canada, we locked ourselves in McMaster University in one of their conference rooms for 3 days, literally, and fought. We battled nonstop until we could come to consensus. And we repeatedly proposed an argument that this was the right amount of exercise. And then someone else on the team would pull out a paper and say, no, Rob, you're wrong. That's not the right. Look at what this is saying. That counters what you just reported. And we did this for 3 days straight, and we survived. It was touch and go at times, I will be honest. And I thought I might lose some good friends during this process, but we survived. And we ultimately came up with evidence-informed guidelines for people with multiple sclerosis. And we've recently extended these guidelines in a meaningful way. So let me walk you through the basic guidelines. So the basic guidelines for aerobic exercise training, they ask that people with multiple sclerosis engage in aerobic exercise 2 to 3 days per week. So not every day, not the majority of the days, but 2 to 3 days of exercise per week was the stimulus that was sufficient to reap the benefits of exercise training. And when you think about that, what we really prescribe is that you start with 2 days a week and then move up to a third day as you get more accustomed and used to engaging in exercise training. How much? We suggested, and the data suggested, that individuals should start with 10 minutes of exercise when they first start up. And this doesn't have to be 10 continuous minutes. It can be 5 minutes and 5 minutes. But when you're doing the exercise 2 days or 3 days per week, you should be getting 10 minutes of exercise on each of those days. And it can be cumulative. So it doesn't have to be in one consecutive bout. It can be in multiple bouts, but it needs to add up to 10 minutes. And as people adapt, we want them to get up to 30 minutes of exercise 2 to 3 days per week. So again, we're recognizing that people with MS need to start slow and build over time. How hard should this be? The data suggested it needed to be moderate intensity. And so how do we determine moderate intensity when people are engaging in exercise? The easiest way to do it is the breath test. If you're engaging in moderate intensity exercise, you can still kind of have a little bit of a conversation with someone, but you can't engage in a full-on prolonged conversation. If you're doing that, you're walking or moving too slowly and not intense enough. But if you're not able to utter but a few words before you're out of breath, you're exercising too intensely. And so we oftentimes tell people, when you think about moderate intensity exercise, utilize the breath test while you're moving. If you can hold on a conversation with a little bit of effort and a little bit of struggle, you're probably in that right range. Now, if you have access to other technology, so nowadays technology rules the world. We have Fitbits everywhere, and Fitbits have heart rate monitors, and they can count your steps. There are other things that you can do. You can use the heart rate monitor on these devices and target different zones for your heart rate. The options that are available. So ergometry, that's a bicycle, that's an ergometer. Arm, leg, or combined. So the reason this is important is some people aren't able any longer to exercise with their legs. They can use an arm ergometer, an arm pedaler, to get these benefits. Or you can use a leg ergometer, or you can use a device that's combined, like that Schwinn Aerodyne, that you're using your arms and your legs simultaneously. Walking, something that we can do anywhere, all the time, for most of us. Walking is a great exercise. It can be over ground, or it can be on a treadmill. And you can even walk on a treadmill holding on to the bars. It doesn't have to be on a treadmill letting go and putting yourself at risk of danger. You can walk with a mobility device over ground. That's totally within the realm of these guidelines. Aquatics, a great opportunity, getting in the pool and doing some swimming was consistent with here. And then elliptical exercise. So, the standing elliptical devices works as well. This was the general exercise prescription that all people with MS were prescribed to do to improve aerobic power. Now, one of the things that we added in this paper by Yumi Kim was the idea of an advanced exercise prescription. That is, you don't just do the same thing forever, because your body will stop responding and stop adapting. And so if you get to a point where you've been engaging in exercise long enough, you can engage in the advanced exercise training protocol. And this involves 5 days a week. Okay, so we're talking about a significant increase in the volume of movement. We're talking about 40-minute sessions on 5 days a week. We're now talking about moving into a higher heart rate intensity and some other opportunities for engaging in exercise. So we're moving towards a more advanced exercise stimulus. Now, the last thing I want to touch upon is safety, because that's really important. And many of us have been told, be careful when you exercise. It might be unsafe. And so my colleague Lara Paludi and Yvonne Learmonth, as another colleague, reviewed the literature on safety in people with multiple sclerosis. And this was the first paper on the safety that was published back in 2014. And one of the things that we did in this paper is we were worried about whether or not exercise was causing a higher rate of relapses in people with multiple sclerosis, because there was this consistent notion that maybe exercise is making the disease worse. And that would be a severe adverse event if exercise was causing a higher rate of relapses. And what we actually found in this systematic review was that there was a 25% reduction in the rate of relapses for individuals who are engaging in exercise compared to individuals who were not engaging in exercise. And is this big enough to matter? Well, our neurologists will remember back in the day that a 25% reduction in relapses was enough to get medications approved by the FDA. So this is big enough to actually say that exercise is not causing adverse events in the form of relapses, but it's actually reducing the number of relapses and the rate of relapses. That's big news. When we looked at other adverse events in this study, there was no increase in the risk of things like falling. There were no increased risks of infections and other things. So recently, we did a more advanced meta-analysis of adverse events in exercise trials. And suffice it to say, we looked at adverse events and serious adverse events. Serious adverse events are things that result in people being hospitalized as a result of some stimulus. And what we found in both of these studies is that on average, across all of the studies that have been conducted, which you can see that there are quite a few of exercise training, the rate of adverse events and serious adverse events is no different with exercise compared to the control condition. So exercise is not causing these adverse events. So the last thing I want to talk about is how do we promote exercise and get exercise into the lives of individuals with multiple sclerosis? There are lots of avenues. There are lots of opportunities, and there are many people who are developing centers and programs for a variety of different exercise programs for people with multiple sclerosis. So how do we get people to start to want to access those and utilize those? So we've been spending a lot of time over the last 10 years understanding the healthcare provider, and in particularly the neurologists, as agents of change to promote exercise in people with MS. And the question is why would we start with a neurologist? Well, raise your hand if you see a neurologist. They're the perfect place to start, right? They just don't know anything about exercise. That's the problem. And they'll tell you that. They know that. So people with MS told us the neurologist is the person we see. They're the person who we value. They're really the person who we want to get the initial push about exercise. And then we talked to the neurologists and they said, yeah, we're willing to do that, but we have such little time that we'll be the agent of initial push. But then there has to be someone else to take charge and move it forward. And so that's where we got into the other elements of the healthcare provider team. The nurse, who's often in the practice, is someone who can do this. And nurses actually receive training on exercise as part of their degree requirements. A physical therapist, what a wonderful opportunity to connect people from the neurologist to a healthcare provider to promote exercise. An occupational therapist is another avenue. Occupational therapists' entire missions are to help people live more active in their life. That's occupational therapy. Rehabilitation psychologists. The list goes on. And so what we've developed and what we're proposing is a model where a neurologist, whom all of you see, becomes the nexus of change, the starting point of change. But then they provide all the reasons why you should engage in exercise that's really salient for you and your life with multiple sclerosis that only you and your neurologist understand, okay? Because that's a very, very privileged relationship that you have. Once that initial conversation about why you should exercise occurs, the neurologist helps you come into contact with the next line of individual to help put an exercise program in place that ultimately will change your life with multiple sclerosis. And so with that, I will say thank you and take questions.
Thank you very much. Everybody give a good round of applause. That was great, right? So again, I'm going to go around the room. Does anybody have a question? Is there a specific heart rate that this person should be trying to get up to in order to do beneficial exercise?
Great question. So when we talk about heart rate, we often will suggest that people should exercise at a heart rate that's about 40 to 60% of their age-adjusted maximum heart rate. So for example, if you are a 20-year-old individual and we utilize age-adjusted heart rate, the max would be 200, and 40% of that would, we can figure out the math there, would be about 80, and 60% would be 120. So your heart rate would be between 80 and 120 during that period of time. That's the simplest way to do it. There are far more complicated ways to do it, but that would be the simplest.
Hi, I have a question about when you talked about the safety of exercise and how it showed that it actually reduced the relapses, which, it sounds good, but what about things you're worsening, but yet your MRIs are still showing up, no new lesions, but you're getting worse, in that you've had this disease for many, many years and your neurologist keeps saying no new lesions, but yet you're getting worse every day and you're losing, okay, well now you're in secondary progressive. Will this exercise help someone like that?
So I'm not going to get into the medical management of multiple sclerosis because that's so far beyond my purview. But what I will be willing to step into is, can exercise be used as a disease-modifying therapy? We actually I published a paper in the premier journal for multiple sclerosis called Multiple Sclerosis Journal that argues that exercise is a disease-modifying behavior. That is, the effects of exercise on the disease itself are commensurate with slowing the rate of disease progression based on the common tools that neurologists use, the neurological exam as an example, based on MRI-related data. We actually have data that show that exercise reduces the number of new lesions and the size of lesions. So I would argue that exercise is a disease-modifying behavior. What I wouldn't argue is you should not replace a disease-modifying agent with exercise behavior, but rather use them in combination where exercise becomes an adjuvant or an add-on therapy to your disease-modifying regimen. And you should discuss that with your healthcare provider in particular. Does that answer your question? So to take it one step forward, does it slow the rate of progression of disease over time? Yes. Based on the neurological examination and the scoring, which is the expanded disability status scale score, there are robust data to show that we can make that plateau, or in some stages of the disease actually reduce the EDSS score, which would make a more normal neurological exam.
My question is, you talk about it as a disease. Exercise can be a disease-modifying drug. Have you also taken this step a little further to look at the, how would you say it, the depression side of this?
Yeah, that's a great question. And let me make one clarification and then make sure I get the question right. So we're not talking about exercise as a disease-modifying therapy, but rather a disease-modifying behavior. I want to leave therapeutics within the realm of the pharmaceutical industry, okay? So behavior. Now, relative to depression, we know that exercise training in people with MS reduces symptoms of depression. But there's one caveat to that. And the caveat is that all of the studies that have been conducted have not actually recruited individuals who have major depressive disorder or a mood disturbance that aligns with major depressive disorder. So we don't know at this point in time whether exercise can be actually used to treat depression in individuals with major depressive disorder. But we just got a $3 million grant from the DoD to fund that very question, i.e., can exercise be used to treat depression in individuals with MS who have major depressive disorder? And that will be done in the Chicagoland and within 100 miles of the UIC campus, to be very specific. So thank you. I planted him in the audience to ask that question as we promote that study. But that study actually will be starting, and we'll start enrollment and recruitment for that in approximately 1 month.
How does strength training benefit MS? Is it similar to aerobic?
Yeah, so it's a good question. So how does strength training affect MS? So strength training would, resistance training would target a different kind of biomarker, that is the skeletal muscle system. We don't know as much about strength training in people with multiple sclerosis, particularly relative to all the different systems that I described and outcomes that I described. And so could it be used in the same way as aerobic exercise? I think so, but it's something that we need to generate the literature on. Just like in talking with Mindy, we need to create that same literature on something like yoga or other alternative forms of movement. It's just aerobic exercise is so far ahead in the race right now. So I would say do muscle strengthening training, but add aerobic exercise in there as well.
Again, based on the MRI study that you said that you showed changes in the MRI, but what about like brain volume loss? Is there studies that are particularly looking at brain volume loss?
Yeah, that's a great question. So we look at brain volume loss in very specific areas of the brain. So we're interested primarily in the thalamus as a major relay area of the brain that's associated with cognitive processing speed. And the hippocampus is another specific area of the brain that's associated with learning and memory. And with aerobic exercise training, we've demonstrated a number of randomized controlled trials that we can increase the volume. So we're not talking about slowing loss. We're actually talking about increasing the volume of the thalamus and the hippocampus as two regions. And then when we look at whole brain, we see smaller whole brain changes than we do relative to these specific areas. And that actually makes sense because these areas are very specifically activated and targeted with aerobic exercise training, because the thalamus is a relay area for all of the sensory information that's coming from the periphery when someone's exercising. It has to integrate that and it has to learn how to adapt. That's why we've seen the greatest benefits in those areas. So the answer to the question is yes, we can actually increase, not just prevent loss with aerobic exercise training.
Have you seen any evidence on breath work for oxygen delivery? This is also an and, right? And therapies and aerobic power and breathing to increase oxygen delivery to the tissues and muscles.
Yeah, so the question is kind of from a respiratory therapy perspective. And certainly if someone has respiratory weakness, doing respiratory therapy would be quite beneficial for that individual so that they can fully oxygenate their blood and deliver that oxygenated blood to tissue for extraction and utilization. I don't think that respiratory therapy from an oxygen consumption perspective and aerobic power perspective is as relevant in people who have normal respiratory power and strength, more so in people who have respiratory weakness. That would be something that would be complementary with aerobic exercise training. It's a good question. I haven't gotten that one in a long time.
Thank you.
Is there any type of exercise that you can relate to, like yoga will help more with this type of motor sensory loss, and something else would help something else, like within the brain?
Yeah, so I'm not going to step too far into yoga because I'm fearful that I might get yanked off the stage. But certainly when we look outside of multiple sclerosis, the evidence for yoga as a mind-body technique and having benefits within the brain proper and for cognition and other mood and affective disturbances is quite strong, right? We would suggest that should apply in people with multiple sclerosis. It's just the evidence in MS, it's kind of lagging, just like resistance training and muscle strengthening is lagging. And a lot of that is due to a very early study that was done at the Oregon Health Sciences University that was funded by the federal government. And it really was a failed study. It didn't show any real benefits for yoga in the 80 outcomes they studied, except for one, which was fatigue. And from a scientist, we just interpret that as chance, although the rest of the world ignored the 79 negative results and focused on the one. So the point of all that is that Mindy and others, we're going to team up, and we're going to start doing very, very high quality trials on yoga and its benefits in people with multiple sclerosis. And I would advocate in particular that we need to think about doing those across the lifespan, from young to old with MS, and across the spectrum of the disease and its manifestation, from individuals who, look like they don't really have MS to individuals who are in a wheelchair, nearly full time, right? So I guess my answer to you is that we need to create the bigger, stronger body of evidence so that in 5 years, I can talk about a biomarker that we're targeting with yoga. Does that make sense?
Okay, thank you. Now I got some online questions for you. All right, the first, have you studied the core body temperature increase, which can affect the ability to move? This seems like it may be a contributor to aerobic exercise.
Great question. So the question is, when I engage in aerobic exercise, does my body temperature go up? And if my body temperature goes up, is that bad for my MS? And is it going to cause a lot of other problems? So the nexus behind this idea came from research, hundreds of years ago, where individuals, when they were heated up, started to develop some temporary vision loss with multiple sclerosis. And so that idea has continued to persist in the world of exercise. And so what's been happening in the world of exercise is that people have studied the effects of temperature changes by putting individuals with MS in something akin to a bodysuit and pumping very warm water into this bodysuit. And this is done with Eric Crandell and Scott Davis, who actually went to graduate school with me many years ago. And they show that when you passively heat up the body, people develop a lot of problems with MS. Okay, they develop fatigue, they develop some temporary visual related problems, things along those lines. So the question becomes, does the same thing happen with exercise training? So we've done, or exercise bouts in this manner. So what we did is we've taken and had individuals with MS do a variety of different bouts of exercise. And before they do that, we have them swallow this pill that is a pill developed for NASA that gets into the digestive system to very precisely measure core body temperature. And we show repeatedly that with aerobic exercise, we increase core body temperature in people with multiple sclerosis. And these are people with MS who tell us that they're thermosensitive, they're sensitive to heat. Now, What do we see as a consequence? Close your eyes. What do you see? Nothing. When we increase core body temperature with exercise, we're not seeing any deleterious effects in people with MS. And so why is there a difference? Well, the generation of core body temperature with a passive stimulus is very different than the generation of core body temperature with an active stimulus like exercise. When you're utilizing exercise, your body is engaging in a variety of adaptive responses to help your body manage that heat accumulation. So we see something very different.
How soon and how much does fatigue actually improve with exercise?
Yeah, so the question is how much and how quickly does fatigue improve with exercise? So I'll start with how much. We have data to suggest that individuals who engage in exercise experience a reduction in fatigue that takes them from being in a grouping of having severe, impactful, deleterious fatigue to being below that threshold of having deleterious, impactful fatigue. So using something like the fatigue severity scale, we can reduce it enough to put people into a non-severely fatigued state. So that's impactful. How quickly does it occur? The body has to adapt, right? So the body is responding to aerobic exercise training. It's going to take a little while. When you first start engaging in exercise, you might experience more fatigue initially, but then over time, as your body adapts, let's say 4 to 6 weeks into ongoing exercise, you'll start to not have that problem with fatigue, and over a greater period of time, that's when we start to see the reduction in fatigue. I'm trying to go faster so we can get to your last question.
Last question is, thank you for that. Going back to the aerobic training, can you describe actual aerobic power more? And how does this relate to the duration, exercise strength, or intensity for the heart rate?
Whew. Yeah, that's a course that I teach for an entire semester. So aerobic power and maximum aerobic power is the maximum rate that someone can bring oxygen into their body, get it into the blood and bound to red blood cells, delivered to the tissue, and extracted, okay? That's essentially aerobic power in the simplistic way. Bringing oxygen in, getting it bound, delivering it to tissue, utilizing it for work, and the highest rate that you can do that. And the second part of that was how to change it?
I have MS, I don't remember.
Okay. The second part of that I'm thinking is, how do you change that? You don't change your heart rate with exercise training. You change the extraction part of it so your muscles become better able to take oxygen out of the blood when it gets to the muscle tissue and utilize it. And you become better able to deliver it because the delivery, it's not a heart rate change, but it's a stroke volume change. Stroke volume is how much blood your heart pumps out every time it beats. And the amount of blood that it pumps out expands or it increases. And that's how we get these adaptations with aerobic exercise training.
Today's sponsors were TG Therapeutics, Biogen, Bristol Myers Squibb, EMD Serono, Horizon, Novartis, Alexion, Genentech, Amneal, and Banner Life Sciences. And again, we want to thank all of them, right? Also, the person who created this whole thing, Mindy. I'm going to say goodbye to you all right? Have a good one. Thank you.